So what about underlying conditions such as say PCOS, PCOD, thyroid, somebody amongst the two have diabetes, do they affect fertility?
They don't directly contribute to infertility. They can be collaborative factors. I would have wanted to do a thyroid test of both the husband and the wife to rule out diabetes in both of them. Everything has its own cause and effect factor. There could be a small fibroid which is on the outer side of the uterus, not creating any mechanical block, not creating any problem for the conception part. But still, though it is not definitive, there could be a certain environmental change in the uterine area. Perhaps that could lead to infertility.
Welcome back to the Pluro Podcast, where we openly talk about women's health. Sometimes the hardest answers are the ones that we don't get. Many a times couples in their fertility journey come across to a point where every test looks normal, every scan is normal, but they're still not able to conceive. This is when they're told a term which is completely confusing and something that is very stressful, which is unexplained infertility. Today we have Dr. Rajesh Modi with us to kind of help us decode this term and lead us to an answer where unexplained doesn't have to seem impossible. Let's start right at the beginning. What is unexplained infertility? The term in itself is so vague, and when couples have been trying for say about a while and they hear this term, they can feel really disheartened. So if you can explain us what this is.
Usually, whenever a couple is coming to an infertility clinic that they have been trying to conceive and they're not able to get the results. So, as a consultant, I would first want to find out what exactly is the reason that the conception has not happened till now. So, there are multiple various aspects which we have to look at when the patient has to be evaluated. For example, so we look at the ovarian function in the woman, whether the eggs are being formed properly, they are maturing properly, and they are getting released on time properly, which is done by ultrasound. So, ultrasound evaluation of one particular cycle is carried out to see the growth of the egg, the maturity of the egg, and the release of the egg. Once it is ensured that there is absolutely no problem with the egg release, that means the hormonal levels are all fine. Then the next step to evaluate is the uterus itself, where the baby is supposed to implant and grow. Whether there is any structural problem or there is any fibroid which is present, which is causing a mechanical problem. Again, that usually gets solved by an ultrasound examination. Nowadays, ultrasounds are quite accurate and good in their output. Then the next step to diagnose would be to see whether there is any problem in the tubal factor, that there is a block in the tube because of which the sperm and the egg are not able to meet or fertilize. So, tubal factor also has to be evaluated. If all these three factors are fine, and the sperm factor is also evaluated in the husband, that the sperm count is normal, the sperm factor is normal. Then the next step here becomes to do a laparoscopic evaluation. So we put in a scope and take a look to rule out any other minor problems which could be missed on ultrasound or on clinical examination, because laparoscopy will not miss anything. We are taking a look actually at the organ inside. Now, at that particular point, if we find some minor problem, something which is stuck or something which is creating an obstruction, we will clear it off in the same sitting and then the problem gets sorted. At the end of this complete evaluation, including the laparoscopy which we have done, if everything comes as normal, that the ovary is normal, the egg maturity and release is normal, the tubes are okay, there is no block, the uterus is fine, there is no fibroid, there is no distortion of the cavity, the sperms are fine, everything is normal, and still the patient has not been able to conceive, and I am at a loss of giving an explanation, then we label it as unexplained infertility, that we are not really able to find out the cause as to why the patient has still not been able to conceive.
It's so strange, sir, this phenomena that, couples go through. But I'm sure there might be certain subtle factors which might not be very evident but do impact fertility and the conception rates.
Generally, when we have that all the factors are absolutely normal in their appearance and patient is still not conceiving, then personally I prefer to label it as a stress-induced factor. which may not be identifiable or documentable, but we believe that sometimes young couples are under a lot of stressful
Career
environment.
stress
Yeah,
or-
either they are wanting to focus on their career, but there is familial pressure or circumstantial pressure that no, they should go in for pregnancy and try to conceive first. Various social and familial issues are there which are not part of our evaluation as a consultant. So these factors also may contribute to the fertility, and that could be a factor of unexplained infertility.
So what about underlying conditions such as say PCOS, PCOD, thyroid? If somebody amongst the two have diabetes, do they affect fertility?
They don't directly contribute to infertility. They can be collaborative factors. So generally speaking, before we call the patient as an unexplained infertility, we would have already worked out these parallel factors as well. I would have wanted to do a thyroid test of both the husband and the wife to rule out diabetes in both of them, because these are collaborative factors, though there is no direct impact, but still everything should be normal before we label the patient as a unexplained infertility. Everything has its own cause and effect factor. Like I mentioned, there could be a small fibroid which is on the outer side of the uterus, not creating any mechanical block, not creating any problem for the conception part. But still, though it is not definitive, there could be a certain environmental change in the uterine area. Perhaps that could lead to infertility. So there are certain factors which may be underlying, but they may not be directly causative.
Understood. So now that you've labeled a couple as unexplained infertility case, what are the next options for them if they want to achieve pregnancy? Say we hear a lot about IUI, IVF, ICSI. If you can explain that to us.
Personally speaking, what I recommend to my patient is, if they have already been following up with a consultant or different infertility clinics for a long duration. Sometimes you come across patients who have been taking treatment from different places for 2 years, 3 years, 4 years with no explainable or definitive causative factor, and yet no results are available. Then I would recommend that they should take a 6-month or a 1-year break from treatment. Not having to think about conceiving, not having to visit a doctor's clinic repeatedly every week or every month. That break itself sometimes clears off a lot of environmental problems within the body. And very surprisingly, a lot of these patients come back with a natural conception. In case it is not happening from that context, there is still no harm in taking a break from treatment for a couple who has been following up regularly for an extended period.
Going through stressful times continuously.
Yes. IVF definitely is the best option available as the last resort. That at the end of it, if the patient still says that no, we would like to quickly conceive and not take a break, then IVF becomes the most viable option. Since there is nothing else wrong, the chances of a successful result in IVF is very high in these patients.
Understood. Since there's nothing else that's wrong, the entire IVF process becomes much more higher in terms of success.
Correct.
Thank you, Dr. Modi, for shedding light on this very delicate and very important topic to do. We've learned that unexplained infertility is often a pause before the progress, and couples do go on and build families of their own. Thank you to all the listeners, and we'll be back very soon.